They call it the warm handoff, multiple healthcare providers with different specialties treating the collective needs of a patient during a single visit. It's the basis for the behavioral health treatment model at Bristol's Healing Hands Health that will soon move to a newly renovated facility equipped to enhance services and increase patient capacity by 60%.
We take primary care and behavioral health and join them together. So let's say a patient goes in for a primary care appointment and they're struggling with depression or anxiety, maybe ADHD or any kind of mental health problems, then you have someone on site there for behavioral health who can come on into the room at that given time and help them out with maybe their current life stressors and everything that's going on.
Healing Hands Health has been providing medical care for the uninsured in our region since 1997. Vision and dental care services were added later. Then, just as the world was emerging from the COVID pandemic, the staff recognized that many of their patients could also benefit from mental and behavioral health services. The ETSU Institute of Integrated Behavioral Health provided the cutting-edge framework needed to treat the whole patient.
One thing, I think for so long we've separated mental health from physical health. And I think what's happening now as this model of care is being integrated in all facets, from pediatric offices, OBGYNs, especially in primary care, because 70% of visits to your primary care provider deal with some sort of behavioral mental health concern. So really being able to have this, it will help patients in their overall physical well-being. Mental health is physical health. That's what we like to say and try to connect those dots together, that you really need to take care of the patient as a whole, the holistic approach, including access to our community health workers who are an integral part of this model. So if a patient is having trouble with housing or food or transportation, our community health workers help them with that as well, so they don't have to worry about their social needs, and that they can worry about fixing what's going on, whether it's hypertension, diabetes, maybe it's anxiety or depression. It's really taking care of everything together all at once. And so I think once we start to focus on that, then people will realize that it's all one and the same, and that we really need to make sure that people are taking care of ourselves.
Let's say someone comes in that is struggling with diabetes and they're seeing a primary care physician for that, but they're having issues with healthy eating, then they're having issues with maybe exercise and things like that, motivation, how to get started. That is where behavioral health kind of joins in with primary care, and we can work on motivational things to help them, diet, exercise, help them with all kinds of things like that. Because what people don't understand is sometimes there is the behavioral mental health side that is the struggle that causes them to maybe not be eating the correct foods, which leads to diabetes.
While assessing community needs, the Healing Hands staff found a high prevalence of anxiety and depression in patients, a lack of behavioral health resources for low income and the uninsured, and low follow-through on referrals to specialists. To meet the region's need, the Tennessee Department of Health provided a $613,000 grant to implement the integrated model. A capital campaign was launched soon afterward to purchase and renovate a nearby building as a new medical clinic that will include both patient exam rooms and collaborative space for healthcare providers.
There's, we call it the heartbeat of that floor plan, where all of your providers, so the mental health nurse practitioner, your community health workers, your residents, the primary care residents, the medical director. So when we are treating patients, everybody is in this community center, so to say, that they can collaborate with each other on a patient's care. So really, this has been just a blessing. Everything has worked and has evolved and kind of come into play, so to say, like all the pieces are starting to fit together. And so to be able to buy this building, purchase it. And so we did do a capital campaign to purchase, equip, and renovate that 9,800 square feet facility to be able to provide the space that is more conducive for this type of model, the primary care behavioral health model, where you integrate behavioral health into the primary care setting.
Associated Builders of Bristol is now renovating the building, which is slated for completion early next year. The extra space will allow Healing Hands to increase patient capacity by 60% to an estimated 3,200 patients by the end of the year. Staff members have provided input during the planning phase to ensure the building meets their diverse needs. And when it is completed, providers from a variety of disciplines will deliver expert care with assistance from students from the region's healthcare programs.
At Healing Hands Health, we've always been very embracing students and residents coming to work here, volunteer here. So we're continuing that as well. So right now we have Dr. Kelsey Lloyd, who's our medical director, and she's our primary care provider as well. But then we also have a contract with, or we provide opportunities for ETSU Health and their residents to come over, and they come over 2 days a week to treat our patients as well. We have a partnership with Appalachian College of Pharmacy, and so the pharmacists are actually an integral part of this, as well as medication management. So if there's a particular medication and a patient has questions about it, Richard is able to come in. He's a pharmacist, licensed pharmacist, so he can come in and talk to our patients as well. We have nursing students from King and ETSU as well that come and are here working with our patients and learning, because there is such a shortage in our area in healthcare, particularly behavioral health. We want this to be a place where they can learn and that we can help with that shortage. We also have social work students that come. They're at the master's level with the intention of becoming clinical social worker as well.
When having the community health workers, involved in this piece of behavioral health really helps out a lot. They really help me with my job. I do the psychiatric mental health part in here. Maybe I'm prescribing medications that the patient is not having a hard time buying or affording or even taking, and to have those other resources here at Healing Hands, such as Carly the Navigator and our behavioral health team, Bree and Sky, help and chip in, it really is what makes this work.
In addition to the $2 million needed for the new facility, the capital campaign is now underway seeking $3.5 million to the Healing Hands Endowment for long-term sustainability. Those interested in contributing can learn more online at healinghandshealth.org. Information about applying for care and services provided is also available online or by calling 423-652-0260.
I think Healing Hands is absolutely a fantastic place. I heard about Healing Hands back years ago when I was in nursing school, but I really didn't know what all entailed and what all they did until I actually started working here. And it's just a true blessing to work with this population and community. As you all know, we serve the people that are 250% below the poverty line, and they're just so thankful to be here. They're thankful for their services. They want to show up, they want to be here, they want to come to therapy, they want to get better, and it's just a blessing to see.